Let's take a step back and talk a little bit about your background, because I know you transitioned from being a clinical nurse to the surgery center. Can you tell us a little bit about the difference between working in the hospital versus the surgery center and what that transition was like?
Yeah, so I first started out when I was new in nursing, went to the first job I could get. And the first job I could get was neonatal ICU. And so started out working with the babies and working in ICU. And from there, because my husband was in the military, I didn't stay any one place very long, which, was hard to get, good experience. But I stayed in the hospital and I did ICU there. And then I've done went the next duty station we were in San Diego, and got to work in more of the mother-baby OBGYN type clinic setting. Then we went to Texas, back in the hospital, pain management and working in med surg. And so in the hospital setting, I had, because I worked med surg that last segment there, I'd have my 8 patients a day, or I might have 9. And, we had all of the juggling of wound care and medications and orders and all this stuff we had to do. And then the opportunity fell in my lap to go give the OR a try. And I was like, well, why not? Let's go try it out. The pain management doctor that I worked with did some of his procedures at the surgery center, and they had an opening. So I'm like, well, I know this doctor. I like him. Let me go work over there and see what it's like. And so maybe not sometimes the best reason to change your job, but for me, it was a blessing. It was wonderful to move, but it was different to go into a surgery center. It's not like a big hospital. There's, we didn't have a lot of the infrastructure maybe that hospitals have in place, like our educators or specific type things. A lot of people wore multiple hats. And then so training and learning in the surgery center was very different than what I saw later when I moved to a bigger hospital and how they onboarded and oriented new employees. So definitely that learning and training and education as a new OR nurse was different, I think, in the surgery center than I guess if I had been in an operating room setting in a bigger hospital.